All right, everybody. I think we're going to get rolling now. Welcome to the changing landscape in healthcare. My name is Matt Kozlov. Little brief introduction on who I am, and then we'll get into the meat of the conversation with our panelists. I'm the managing director of the Cedars-Sinai Accelerator powered by Techstars. We are a two-year-old program that brings in really fast-growing healthcare technology companies, brings them in for 3 months where, with the partnership of Cedars, our mentors, and Techstars, we help them accomplish in 3 months what it would take them 2 years to do. In our last cohort, we had 11 companies, all closed commercial contracts with Cedars-Sinai in under 90 days, and then coming out of the program, they raised a collective almost $20 million. And we're currently halfway through our second cohort, and we will be starting our third cohort in September. So brief plug, if you guys have promising healthcare technology companies that are looking to move faster and work with and commercialize rapidly with a top academic health system, come find me. I'm matt.kozlov@techstars.com. But now we'll hand it over to our panelists, and we'll start with Cara. And if you could tell us who you are, what you do, and what your company does, that would be great.
Sure. Hi, Cara Kelly. I'm a vice president at Avalere Health. Avalere is an advisory services company that's headquartered in DC, and we advise clients sort of all across the healthcare spectrum on federal and state policy developments, so pharmaceutical manufacturers, health plans, provider groups. And my background that's sort of particularly relevant to the discussion today is that in addition to working at Avalere for about 6 years, I spent 4 years doing ACA implementation at the federal government. So really looking forward to the discussion today.
I'm Patrick Quigley. I'm the CEO of healthplans.com. And put simply, healthplans.com is a place where consumers can go to make smarter decisions about their health insurance. We like to joke internally, we're the largest consumer brand in health insurance that you've never heard of. Over the last 2 years, we've delivered 20 million consumers to carriers or brokers to get enrolled in individual plans.
Great. So I guess it's good afternoon. Adam Kaufman. I'm the president and CEO of Canary Health. And briefly, we're dedicated to the mission of empowering people with chronic conditions to prevent them from getting sicker. So we provide digital programs that couple education with tools to help them set goals, track their progress, interact in a small group social environment, as well as coaching.
Clayton Lewis, CEO and co-founder of Arivale. And what we do is focus on helping individuals first optimize their wellness, and then second, avoid transitions into disease states. And we do that by creating a very dense, dynamic set of data, and then assigning individuals a licensed professional coach that brings that data to life every month with 2 to 3 actionable recommendations.
Excellent. So digital health and healthcare technology have been, I would say, as a relative recent entry to the market, explosive. Funding in these categories has risen 27% this year compared to last year. And in LA alone, this was actually the single biggest category for funding. $77 million across 37 seed and Series A deals in the health and wellness category alone, surpassing media and entertainment in LA. Why healthcare? Why now?
I'll jump in. I think there's a couple key trends happening, and first and foremost is sort of the move towards value-based care. I think payers, whether that's the employer, the health plan, or the government, want to ensure that their dollar is now generating outcomes that matter. And then I think in parallel is the move towards consumerism, where we're both holding individuals accountable for more of their health, and then we're asking them to take responsibility for that. And at the same time, we need a set of tools. And I think there's no way healthcare as it's constructed with, predominantly is still face-to-face or maybe telephonic interaction can reach that. So digital tools are needed, as they've shown in the rest of the world, to really drive that change to do that. And I know the mic's picking me up as I turn my head differently, so I apologize for that.
I think what's going to be interesting, though, as we look at these tools is that there's 3 reasons historically they've failed, and there's 3 reasons that the wellness category has failed. So the first reason is Americans, individuals, don't wake up and think, today I want to be healthy. Chocolate cake, risk of diabetes tends to be a pretty clear choice. And so the first thing these tools have to do is they have to leverage a baseline motivation that people actually care about, and they often fail in that. Second thing is that data actually paralyzes people. So how many people do you know that have a Fitbit, and they have no idea where these 10,000 steps are taking them? And so these devices get thrown into a drawer, usually after a few weeks, definitely after a few months, because the data is actually not linked to anything they care about. And finally, as you look at these companies, I'm relatively skeptical as a former venture investor that individuals would come in and be so proud they'd eliminated all human interaction. It was about the app, it was about the computer program. And what we at Arivale believe is actually behavior change takes engagement from individuals. And so we've got to be careful of this shiny new object to make sure that it's actually driving to health outcomes.
Matt, I think there's also a kind of a simple reason that now is a good time for healthcare is that due to the ACA and Obamacare, it's really forced a discussion, a national discussion around healthcare more than maybe in the past, right? You have 40 million individuals that are getting their healthcare from outside of their health insurance outside of employers, and these folks need to go somewhere to get insurance. And if you create an open enrollment period, whether you like or dislike Obamacare, it has created an event where the nation kind of goes and knows they need to enroll. And so that in and of itself creates the need for healthcare to be a consumer product and healthcare to be a consumer discussion.
Yeah, and I guess, just to sort of piggyback on what you said, I think that as we go through the next couple of years, right, substantial policy change likely to happen. I think that the direction that we're moving in will only emphasize, right, the need for consumers to be really actively engaged in their care. They will potentially have sort of higher out-of-pocket exposure, maybe less generous benefits, different types of benefits. So I think that the need for tools that help people make decisions in that environment will only increase.
So you guys brought up a few really interesting categories that I think I'd love to dive into. One was policy changes. One was maybe enabling technologies that maybe didn't exist a few years ago that now enable us to do things with our health, or healthcare systems to address our health in new ways, and changes in consumer attitudes. So let's start with changes in consumer attitudes. Are we different people today than we were 10 years ago when everyone was talking about digital health and wellness? So has that changed, Clayton?
So I think what consumers are interested in is that they believe, and they're starting to get insights into, it's not just that I go to my physician and he or she gives me a roadmap. It's actually, I've got access to data now and I can start to make decisions. So if you think about changes in often staid old industries, they're driven by consumers. So think about real estate. It used to be the realtors held the keys to the multiple listing service. Then Zillow blew that out of the water, gave us access to all that data. So we have a very different relationship with realtors. Think about travel. I'm 57, so back in the day, if you wanted a great airline ticket price, you had to go to a travel agent because they had all the data. So now what I think consumers are interested in is they've got access to data. They want to have a very different relationship in terms of with their healthcare provider. And also consumers are getting insights. There's 3 primary drivers of our health. So the first driver studies would indicate are genetics, 30%. And consumers are starting to get interested in genetics. The second driver, behavior, lifestyle, environment. That's 60%. Healthcare system is only a 10% driver in the outcome of our health. So think of how upside down our economy is, that we're devoting 18% of our economy on the tiniest sliver of what's actually a driver of determinant of health. And so consumers are on the cusp of starting to understand, 1, I've got access to data. 2, okay, I'm just not going to turn to my physician to give me a roadmap of what to do. I want to have a very different relationship. And then, as my colleagues have said, the cost transfer is starting to catch their attention.
Any other thoughts on changes in consumer behavior?
The only statistic I would give, so I don't think we as individuals have changed, but the system has. So even before the election and arguably more push towards individual responsibility, the estimate was the average family will bear out of pocket all of their health care expense.
Yeah.
So the height of the rise of high deductible plans coupled with how health utilization goes, the average family will pay for all of their health care out of pocket for the first time.
No, I think that's an absolutely critical point, right? Because then this has to become a consumer product. It's not just the data, it's how do you digest the data to make better decisions? Because you're right, like people that are wearing Fitbits, like it's really neat for a little while, but then how does that translate to better outcomes for me? And it goes into wearables, data, there's great apps obviously in terms of helping with wellness and managing of disease, but all the way back to kind of making the right choice when you're entering the system around health insurance so that you're not having to pay cash everywhere. So we have to figure out a way. And as consumers are trying to own this particular more, it's like, how do you go ahead and help people make better decisions across the spectrum?
So let's talk about policy, the 800-pound gorilla in the room right now, or elephant, sorry. A lot of uncertainty, changing investment behavior, maybe your own product and company roadmaps. Cara, if you're a healthcare investor or a healthcare entrepreneur right now, what do you do? What do you make of this situation we're in?
Yeah, it's, as you said, quite uncertain, but we are starting to see, there were key themes right before kind of earlier this week when the House released their repeal and replace proposal. There were some core elements that we're seeing sort of over and over again. And I think that if I had to boil those down to sort of three things, right, it would be sort of capped federal investment in Medicare, Medicaid, consumerism, and more flexibility for states and issuers. So, I think that overall, biotech, pharma, health plans, depending on sort of how they're positioned in each of the different markets, seem to be relatively well positioned. I mean, they have certainly concerns, I think, about the repeal and replace proposal. The plans are really focused on what's going to be the risk in the market and what tools do I have as a health plan to manage that risk. Pharma, biotech, right, very concerned about access to insurance and what the coverage looks like. But we were sort of following very closely all of the different stakeholder reactions to the House proposal in particular, and the stocks didn't move that much in those two sectors. I think the groups that are most concerned at this point are the providers, particularly the hospitals are very concerned about changes to Medicaid and the potential that sort of uncompensated care could increase. So I think that there's some risks, but also opportunities, and I think I was really interested to learn about the companies that all of my co-panelists represent, because I do think that there is tremendous opportunity to help people sort of navigate through this change and understand what's happening to their benefits, what's happening to their options.
Patrick, you seem to be well positioned to maybe take advantage, not in a bad way, but of the uncertainty that patients have in finding health plans.
No, I think it's a really big opportunity for us, and we're obviously very excited about it. There's kind of a little bit of a misnomer, and those of you probably in the room understand this, but the exchanges have provided very limited solution even under ACA. You can only get an on-exchange plan on healthcare.gov or in the state exchanges. There's off-ACA plans, and because of loopholes in the laws and because of litigation, frankly, there's so many other options that are now out there that look to consumers more attractive. So we expect that in the new environment, it's not going to get simpler, it's going to get more complicated. There's going to be more choices. And so we're excited because even though we imagine that the next few years are going to be a bit of a goat rodeo in terms of what's going on, as it settles, there is going to be a need for someone like us to step in and really help provide the data to help consumers make better decisions and help them through a very complicated decision process. So yeah, we're excited about the change. We hope it could come a little faster so there's not ambiguity for consumers in the middle.
Do your patients get affected at all? How do Canary users, who pays for it, and does that potentially change in an uncertain future?
Yeah, so our clients are the health plans who are trying to engage their populations to help them get sicker, lower cost trend, and often build a tighter relationship with their members. I think Cara hit it. Different product lines, if you will, within healthcare, we'll see it. So I think if you have a business focused on Medicaid, that's going to be a harrowing time just because it's unclear how Medicaid will get funded, and then each state is going to have a different thing. If you're focused on Medicare Advantage, which is a portion of what we do, or the commercial business, I think it'll be relatively stable. And so it depends a little bit on who your product mix is. And so certainly different opportunities will go. After the election, I looked at our team and our investors and said, look, the last time we saw a major shift, so when the Affordable Care Act was passed, we saw a lot of paralysis in the market. Having nothing to do with whether the policies were good or bad or where they were going to go, is simply change is hard. We are not seeing that. We have not seen any slowdown in what people are doing. We've not seen any slowdown in buying behavior. In fact, I think it's accelerating. They have to get through the final legislation, but I think the bigger risk is not so much does this shift from what the core processes have been or the core value statements, it's do we lose time?
And then the third area that I think was mentioned as a general theme was enabling technologies. So new innovations that make outcomes or treatment or data available that wasn't there before. I'd love your thoughts on maybe what are some of the highlights for you.
So imagine a picture where you come in and instead of presenting yourself to the healthcare system, which of course is really an illness industry, because what are you doing but you're presenting yourself when you have symptoms. So you come into a program, you get a multi-omic scan, you understand your genetic predisposition for the 60 most common top diseases, and then by looking at all of your clinical labs, you understand the result of your life choices to date, and that rolls up into a calculation score of what are your risks for major diseases, and then ultimately what's an action plan to start to lower your risk profile long before diseases appear. In this room right now, numerous individuals have disease states that you're moving towards. You may not know it for years, some of you decades, because often the presentation of symptoms takes that long. And so what's interesting when you think about healthcare reform, and really what Obamacare did drive, is that private organizations and state organizations now are issuing what I call fixed bid contracts. So I'm on the Board of Trustees of Harborview Medical Center, Trauma One Hospital, but also the county hospital. We bid and won a contract to take care of X thousands of lives for a very large employer. As part of winning that bid, we agreed to not increase our prices over 6 years, to continue to take care of those individuals. Now that's a very different model than the historical model of us increasing our prices 12% a year and people agreeing to it. And that, I think, is one of the trends that people don't fully appreciate, is that now the state of Washington is issuing a similar contract. Other employers are doing the same thing, where if that is the trend, then healthcare actually has to figure out how do we keep people well, as opposed to continuing to increase our prices to treat illnesses very effectively.
So I don't know if we'll get to them, Matt, so I want to make a plug for, and then I'll answer your question in that context, for Southern California really being the place where I think the future of healthcare will be built. And in large part, I think it's because a lot of that infrastructure plumbing has been built. And we should go back to the High-Tech Act more than the Affordable Care Act that put a lot of money out there to basically wire doctors and hospitals' offices and really make the EMR, not quite totally pervasive, but very pervasive. And so if you think about sort of where we were 10 years ago, it was this foundational back office stuff. The generation of services that are coming are the ones that are going to engage consumers. It's not just there will always be innovation in small molecules, there'll be innovations in technology, but the fact that we can now do these things and reach a consumer and it's relatively easy and the API infrastructure is there. I was an early customer of Tibco, and I remember we shelled out $1 million for middleware. I don't even think the category exists anymore. Yeah. So I think Southern California, with its mix of media, its ability to talk to consumers, to get commerce right, is really where healthcare is going to go. And so the short answer is I think a lot of the infrastructure is in place, and I don't know if we'll get there. So my plug is this is the place where we should be doing it, and folks like Cedars and what you're doing are leading that, but also the sort of the network of companies that are being built around it.
Isn't one of the challenges, though, not to kind of pile in here, though, around
No,
the
add to Southern California.
Yeah, well, I'm always a big fan of
There you go.
Being from Cleveland, I understand it takes time to get this right, to get out here. So I think a lot of the challenge, though, is more about the transparency of the data, right, around better health outcomes, making people understand kind of the genealogical kind of aspects, absolutely. But if you're trying to decide what healthcare is appropriate with the data knowing that I need healthcare, there's just as a consumer, there's just not enough information about which doctor has done this 72 times, or if I need an MRI, where do I get that for $300 versus $2,000? Like, how do we solve that problem?
I think it's both sides, right? So, we need better transparency of the data. But if consumers aren't sort of understanding how this fits into their lives and how health is one of the other things, they're not going to step up to the challenge. Personal story, so my first son was born in Connecticut, and of all the things of the hospital, which was a great hospital there, we remember that they gave us a lobster dinner at the end. Okay? That has nothing to do with healthcare, but that's what everyone talks about. Second child born at Cedars, probably a better healthcare setting. Room's a little smaller, the bed's not quite as nice, different experience. So I think the consumers are getting this, the data will come, and you're gonna have to work on both sides.
I mean, I guess from a sort of policy perspective, right? Like we think about sort of different subpopulations of consumers, and I guess how do you sort of address like the people who are costing the most, right? Are in some ways the most challenging to engage with, with some of this technology. People who are elderly and disabled, right, or very low income. I think that's a big challenge. I think that we'll have to sort of figure out, right? Because I think that the potential is there, and you're right that sort of once people see it and they get it, I think
Well,
they buy in.
The risk, right, is that most of the cost is in 55 plus, and are we still building two health systems? But I think in some of the work we're doing is to the caregivers themselves. Can you couple sort of technology to in-person delivery? So I think it'll come around. But if you're really dealing with cost, as a statistic, so there are, I can't remember exactly, I think 500,000 dual eligible, meaning Medicare and Medicaid eligible people in LA County alone. Their healthcare is $13 billion a year, right? That's more than the revenue of all but the top 7 or 8 health plans in the country, just those who have Medicare and Medicaid. So it's the huge part of the cost problem, but I think there's creative stuff being done to leverage technology, not necessarily at the point of the consumer experience, but to support the people supporting that consumer.
Can you solve that problem though without an individual mandate?
Well, so I think there's a lot of different perspectives on the mandate, and I guess we'll see, right? I mean, there was some.
Well, it seems like it's clear.
Well, right. Well, it's clear where we're going, I think, and we're going to bid a fond or not fond farewell to the individual mandate. I think there were different perspectives on how important it was, right? I think for the health plans, it's very important to have some sort of forcing mechanism, get people into the market, balance the risk pool. On the other hand, the penalties were relatively modest. I think a lot of people chose not to pay it. So, whether they can accomplish sort of a similar effect with a different mechanism like continuous coverage incentives, I guess we'll see on that. But I think you're right. You do need some sort of motivating and forcing mechanism to balance out the pool.
So we have a few minutes left. If you were unencumbered today with your existing business, exited, very happy, could do something entirely new, let's assume it's in healthcare, what company would you start today? And I'll start with Clayton.
My company's only a year and a half old, so I think I've answered your question. I'm doing it.
Oh, that's tricky. So ours is 2 years old, so probably the same. But I do think you're still seeing a lot of vertical integration. I mean, I think we're at the phase of the industry where you're starting to see kind of what is one sector versus another, but it's not uncommon in early stages. So if capital and things were an issue, I'd be very esoteric and probably start a diabetes special needs Medicare plan and own the whole stack.
I'm doing exactly what we'd expect. I mean, my industry hasn't really even been born yet, so with all the changes that are happening right now, so no, I mean, time is all of our greatest asset, so I think we all vote with our feet on that decision. Yeah.
Cara?
So I'm like the resident nerd in the group, the policy nerd here. So, we've talked a lot about the different consumer-facing tools. I think those are really cool. Another area that I think is interesting that we haven't talked about is sort of payment and delivery reform, right, and population health management. And I think that is sort of untouched, right, by some of the policy change. So I don't know, maybe something that would sort of help providers take on risk and better manage patients with some of the same data that we're talking about.
So a lot of investors tend to be scared by healthcare. 12, 18-month sales cycles, at least for companies that are selling into health systems. It's probably not much better if you're selling into insurers. For the investors in the room, what would you like them to know that they don't understand today? Or should they be, if they don't know this space, should they not even be trying because it's a very specific kind of industry to invest in and they might not have the same expectations that a healthcare-focused investor would? So I'd love your thoughts on that.
Well, as a general partner for 8 years, I think 3 things. One, you clearly have a narrow focus, and so in healthcare, you could boil the ocean and learn very little about a lot quickly. And I've been humbled by my 14 years of being a trustee at a Harbor View hospital in terms of what you have to learn. Second, it is about the team, and so what have they done before, and what do you believe they're going to do, and are you aligned in terms of what you're trying to accomplish? And so I think what's interesting then in healthcare is that healthcare is a broken model. So it's an illness industry, 18% of the GDP focused on treating symptoms. And as an investor, I looked at lots of businesses that were trying to optimize this broken model. And so what I think is interesting from an investor perspective is companies are actually trying to shatter the paradigm of the existing model, and what's the opportunity there?
So, assuming we're speaking to sort of a classic tech investor, consumer technology, what I would say is there's sort of really 4 funnels, at least in our business. So you've got to sign the payer who cares about it. You've got to convince them to give you as broad an eligible population. So, if you think about the breadth of pilots, that's that second funnel. You've got to get those folks to sign up. So you've got your classic consumer funnel, and then you've actually impact them. And so, each of those is a skill set that is hard. They're somewhat related. But the idea that you could do one of it really well and then tomorrow have, 10,000 users and then 2 million isn't going to happen, because you've got to hit each of those steps. So I think just being cognizant about, what it actually takes to execute in that funnel.
Sure. They're all good things. We're very biased, obviously, on health insurance. The one thing that we would say is that traditionally people think about the entry into healthcare being the doctor and the primary care physician. From our perspective, it actually is before then, and it's actually health insurance. We think that the making good decisions around health insurance is the actual key to ultimately getting to good care, and more time needs to be spent at that entry point, because that actually oftentimes determines who the doctor is and determine the path of care. So from an investor perspective, we're always kind of saying, hey, we believe that if we can help consumers make better decisions around health insurance, we can help them make better decisions around health care ultimately. So from our perspective, from an investor pitch, that's kind of one of the places we start.
I don't know that I have much more to add there. Our whole business is built on the fact that this is really complex and difficult to understand. So that's just fine for me.
Well, I think that might be all the questions we have time for. Thank you to all of our panelists, and thank you to all of you for coming here.